Hello class, my name is Megan Parmer and I'm excited today to discuss an ethical scenario and how we as nurses and future nurses can impact our health informatics. Let's get started. The scenario reads, Robert is a physical therapist and he creates a list serve from his own internet service at home for his different patients and their educational needs. He establishes one list for each of the following conditions: total knee replacements, total hip replacements, and chronic back pain. He automatically enrolls all his patients that he has an email address for into the appropriate list with the intention that they can share information and support each other, as well as for him to share general information of tips and pointers. Everything is going well for the first month. However, a virus is introduced into the list and everyone is now contaminated. The virus has damaged the patient's hard drives on their home computers, and some patients' work computers have been damaged too. The patients contact Robert's employer and demand to be reimbursed for all damages to the machines and are very upset that these lists were created in the first place. However, Robert's employer was unaware of the lists. A computer virus is a large term and can be broken down into two subunits. Worms and viruses are two examples, and yet they work in different ways. However, a worm and a virus can debilitate technology and impact informatics. First, a worm is a self-contained program that replicates itself and sends copies to a connected computer. Unlike biological worms that spread slowly, computer worms spread rapidly and without much user interaction between computers of a network or the internet. On the contrary, a computer virus is a program that implants a version of itself in any program it can modify. The changed program, or modified self, attempts to correct and change other programs directly connected. Computer viruses spread slowly by sharing data on infected disks or diskettes. Here is a great picture that helped me understand how technology impacts and can spread to other databases and computers. As we look into the scenario that was given, Robert the physical therapist violated some ethical and legal aspects that are imperative. First, non-maleficence is doing no harm. Even though he did not mean to harm his patients and violate their privacy, he caused harm on their computers and risked their protected information from getting exposed or hacked. Organizations and individuals that provide health information on the internet have obligations to be trustworthy, provide high-quality content, protect users' privacy, and adhere to standards of best practice for online commerce and online professional services in healthcare. Second, autonomy was violated because the patients did not have a say in the shared information database. Why were they not asked first before Robert started creating these lists? Why were the patients not included in this process to see if they really wanted to do this? Third, negligence then happened. This is when the standard of care is lost for patients. It is intentionally imposing risks that are unreasonable and/or unintentionally by carelessly imposing risks. Robert did that. He unintentionally and carelessly put together the patient lists without thinking of how it could affect others negatively. He would have assessed the situation and issue and discussed it with his team and each patient. It would have been different. Fourth, beneficence is the act of doing good. I strongly believe Robert was trying to complete these tips and pointers out of his genuine heart. However, he did not think of the pros and cons that could result from sharing data through multiple computers, ultimately not upholding doing good. He in turn risked patient information, caused a multi-virus, and now has ethical and legal problems. Other key ethical violations that occurred that are discussed in Chapter 5 are candor, or being honest, quality, informed consent, privacy, and professionalism. He did not open up with his team because in the scenario the employer had no knowledge of this. He did not uphold the quality of the database because a virus erupted and caused horrible problems, and he never consented with the patients or his office to invade everyone's privacy, ultimately risking his and the team's professionalism. All clinical situations are not the same, and even though the result of interacting with these systems and tools is enhanced information and knowledge, the healthcare professional must weigh the information in light of each patient's situation, including that individual's beliefs and wishes. Patient outcomes is the priority, and as healthcare professionals, we need to analyze and synthesize the parameters of each distinctive situation using specific decision-making. In addition to the ethical considerations for practice, healthcare professionals must abide by laws governing the use of health information. The Health Insurance Portability and Accountability Act, or HIPAA, was created to curtail healthcare fraud and abuse, enforce standards for health information, guarantee the security and privacy of health information, and ensure health portability for employed personnel. The primary requirement, which went into effect on April 14, 2013, limited the release of protected health information without the patient's knowledge and consent. Information that is shared through technology must have a safeguard to protect patients' information and healthcare data. In addition, the HITECH Act provides protection for a patient's information by securing it and keeping it private. Robert violated HIPAA by not consenting with each patient and asked if it was okay to share their diagnosis with other people. He just automatically enrolled each patient onto the list and did not consent with his employer. HIPAA is a very serious act, and legal ramifications can result if patients' privacy and information are compromised. As I listed on the slide above, penalties such as financial, jail time, and job loss can occur. How could have Robert protected his patients better without violating HIPAA? The rights, well-being, and safety of a patient should be the primary factors in arriving at a professional judgment concerning the disposition of confidential information received from or about the patient, whether oral, written, or electronic. Only information pertinent to a patient's treatment and welfare should be disclosed, and only to those directly involved within one's care. First, to increase education and support, Robert can give tangible papers to help aid in knee replacements, total hip replacements, and chronic back pain, and help explain the exercises. This will increase confidence at home and help patients feel supportive. Second, after the patients agree and consent to let their diagnosis and information be used, Facebook could be a creative way to create a communication board or group. In this board, patients alike can comment and encourage each other through videos, comments, and posting real stories. Doctors and patients can post videos and ask questions pertaining to their PT. Facebook is a social media platform, and there will still be risks of hacks and viruses, but it will be a great option to enhance communication while creating community help. Most importantly, patients need to be told the pros and cons prior to consenting. Once they are on board, a trial run should start to see how successful and interactive all the patients are. Educating each person on suspicious links, ways to avoid hacks, and ways to increase success would be a great start. While the group is on social media, no private or secure information should be listed or posted, just information pertaining to medical conditions. Medical videos, advice, and encouragement could increase each patient and increase their hope, sense of community, while in turn also increasing their physical activity. The reason this happens with technology and informatics is because of faulty databases and insecure information. Viruses and worms can get into these systems and ruin patients' security and privacy. This damages their trust in medicine and hinders future professional counsel. The main consideration and issue is how can we protect our patients and their information? Robert put all his patients at risk by exposing unconsented medical information. Also, this led to increased financial stress due to each person having their computer fail. Healthcare and informatics go hand in hand, and we as providers of care need to ask patients' wishes, protect their privacy, and secure their data at all costs. This is my last slide, and this is all my resources that I used. Thank you for listening, and I hope you learned a lot.